Well, hi there, Mrs. Richardson. How are you?
I'm doing very well. Thank you.
Good.
Thank you for fitting me in your schedule.
Yeah, not a problem. And I know we've, only met a few times, but hopefully you understand what I called you in for today. And number one, when I said, Mrs. Richardson, don't take offense. Is it okay if I call you Olivia at this point?
Oh, sure. We're friends. That's fine.
Okay, good. I always try to build that trust, but sometimes I just always want to start out and make sure we're in a good place. Brought you in today specifically on a timeline that I reach out. If you remember when we first sat down and we went through that 2 pathways of Medicare, we talked about path one being that what you're in now, right? And we've got our Medicare card, we've got our drug plan, and we've got our supplement. Path 2, the Medicare Advantage, you chose path 1, right?
Yeah.
And if you remember, in Missouri specifically, we have what's called the Missouri Guarantee Issue window.
I do remember something about that I basically wouldn't have to answer health questions.
Yep.
Okay.
So the beauty is Missouri is one of roughly, I think, 11 to 13 states right now that have what we call a birthday rule, right?
Okay.
Now, calling it a birthday rule can get confusing. Every state has a different window on when you can do that, not. But when we talk about 13, really the majority of states don't have that.
Okay.
Well, the beauty of what that brings to the table is guarantee issue windows. And all that means is we have the ability to adjust the supplement, just like you said, you remember well, without doing health underwriting.
Got it. Okay.
Got a couple hoops we got to jump through in that, but we'll get to that here in a little bit. But
Sure.
what I do is I reach out to all my Medicare supplement clients 30 days prior to the effective date of their policy. That's what drew us in at this point is, so we're in May. You've got a June 1 start. What we'd have in Missouri is 30 days prior, 30 days post, where we can adjust Medicare supplement to Medicare supplement if we stay in the same letter.
Okay. What happens if I'm outside of that window? If I don't, answer your call then?
So what's beautiful about a Medicare supplement, we can adjust any time of year we want. We could do, now, no reason we should ever have to do this. We could do 4 adjustments a year. It wouldn't be fun for you. It wouldn't be fun for me, right? But we could. That's the flexibility we have. But what's specific about this, and I'm going to get to that answer, but I'll explain, is during this window, we can only go same letter to same letter, okay?
Letter being the plan. What plan am I on right now?
G, if you remember correctly.
Okay.
And if we need to roughly go through what that G does, remind me, and we'll hit that pretty quick.
Sure.
And I think it's going to be good to go into that because I'm also going to talk about an opportunity that we may have this year that's pretty unique, right? I don't think it's going away. It's something we're going to continue to talk about. But G to G in Missouri or some of these other states that offer birthday rules is an option, right? That being said, G has been our most prominent plan for a long time. And if you remember last year when we went over this, it still was. Well, the market is changing.
Okay.
Okay. And anytime we either adjust not same letter to same letter in that 60-day window in Missouri, or we change letters, G to what I'm going to discuss today and N, we then have to go through health underwriting, okay? And all that means is we don't have the same guarantees. When I go G to G during a Missouri guarantee issue window, I can look you in the eye and go, look, no questions asked. I get these 2 documents. We send it in. We get you in that new G. The reason we're going to do that, generally price. Okay? So if we're not going G to G, we're going either G to N or we're doing a G to G outside of that 60-day window in Missouri. We're going to have to go through basically a 2-page questionnaire. It's going to be some pretty straightforward health questions. The good news is I've done this enough that I have a pretty good grasp on who can pass, who can't. And if I don't think you can, I'm going to tell you, look, I don't feel great about this, but we can answer these honestly. We're going to go ahead and try. If this doesn't work, we'll try it with somebody else.
Does it hurt me if somebody says no to me? Does that mean I'm blacklisted from all the other carriers?
Not necessarily blacklisted. On some of these applications, you can have a questionnaire that says, have you been denied or uprated? Yeah. And so what I always tell people is we're going to be as honest as possible, right?
Okay.
I've also done this long enough to know that who are my companies that we underwrite the simplest, are a little more flexible, or even it's not standardized questions in each of these. I've got some that ask different questions, so I know based on your health situation, what's going to give us the best opportunity.
Okay.
Okay. So with that being said, going through the assessment we did on you last year, any changes in your medical? We look like we've been pretty healthy. Anything significant happened this last year?
No, my hip's starting to act up. I haven't gone to the doctor for it or anything like that, but I'm thinking I'm probably gonna have to go soon. I think the other hip's gonna need to replace soon.
Okay. Well, good. Not good that your hip hurts.
Sure.
Right. We don't ever want that. But the reality is you're aware. And so what we've got to be very careful about is guarantee issue windows. If we're dealing with something current, we have a chronic issue, we're going to have to lean pretty heavily on a guarantee issue window, right, to do that. But if we don't, based on your situation, joint pain, that kind of stuff, as long as it's not rheumatoid arthritis or some of these chronic issues, we're going to have the ability, I think, to do an underwrite. So we'll discuss where that may or may not be a good option for you at this time. So just good to hear that the health has been good. Here's what I love. My clients that come in that have no pain, I kind of look at them and I go, what have you done? Right? That's a little boring. That wear and tear stuff at this point in our life, we should have a little, right? So that's nothing to be ashamed of. We'll go through this health questionnaire and we'll see if we think that's most appropriate. So let's talk G to N if that makes most sense.
Sure, yeah. I'd be really interested. You said there's money savings in that, or what's the reason I would?
Generally, the whole conversation today is money savings. Even G to G, we're going to do that for discount.
Sure.
If you remember, we discussed that in a little while ago. I don't expect you to sit there and go, oh, that's, and teach me. But to explain that difference, there's subtle differences, and we're going to talk about risk. So when we talk about a G plan, that's the majority of my clients. The majority of my clients are in a G. Now, the reason I'm talking an N is not because an N is brand new, but the industry. The industry pushes us in the direction they want to go. And what we're seeing is our G significantly having increases. Now, the N's still taking increases, but they're not as significant as that G.
Got it.
And when we compare these side by side, I'm going to talk about the risk factors. You may look me in the eye and say, I still want to be in a G. Great. I'm still going to have plenty of people buying Gs, staying in Gs. But the industry is pushing us to where cost in particular, the N is becoming more and more feasible for a good option.
Okay. That makes a lot of sense.
Okay. So the G, let's kind of refresh on what a G does and doesn't do.
Sure.
So the good news is, we look in the Medicare and You handbook, there's a chart that shows each one of these. And if you look, all of them cover the 20% that A does not cover under your Medicare equally, right? So that's off the page.
So that won't change.
That won't change.
Okay.
When we get into the B coverage, that's going to be where we look at the differences between a G and an N, right? Subtle differences. But the simplicity of a G is when we go down that chart, 100% covered on all Part B charges. So that 100% refers to the 20% left over after Medicare.
Sure.
Every category except two.
Okay.
One being 80% international, right? And that is as good as it gets with any of them. So we're still in the Cadillac plan.
Okay.
The only gap that it does not cover is the Part B deductible.
Which I'm doing that now. I've been paying that for the last few years.
Nothing new, right? And right now, if 2024, $240, I want you to be prepared. As we've said, not only will SUP premiums go up, the reason we're talking right now is these comparisons, the deductible. You can plan on that going up every year. We had an exciting year about a year ago where it went down. Don't ever expect to see that.
Fair enough.
So the nice thing is a G is a G is a G. Remember, so if we switch G to G, we're not changing coverage at all. Federal law says these are mandatory. They're the same thing, right? So that would be the G to G. Why G to N? One is cost, but we're going to talk about those other gaps. So we look at the N, we've got that same 100% covered on A and most of our B, right? The thing that is the same between G and N is neither of them are going to pay that Part B deductible for you, that $240.
I'll just keep paying that the way I have been.
That will not change. But if we go to an N, what you can expect is then what's called Part B excess charges, okay?
Okay.
This is one of the more confusing things to explain, but I try to keep it pretty simple. Anybody that contracts with Medicare can take assignment or not take assignment, okay?
Okay.
Don't try to make that complex. Is basically they're agreeing to the contracted charge that Medicare does.
Okay.
Now, 99.34% of all Medicare doctors take assignment. That's the scenario we're in now.
Okay.
For that point, 6.6, whatever that is, nationally that don't, those people, if you go and get a Part B service, you can be charged 15% more than the national average of cost for that procedure.
Okay.
So the risk is I'm not a statistics person, right?
Sure.
But that 0.66, it's not a huge risk, right? We'd almost have to go search for those people. The good news is I've had physicians who are my clients, and I've talked to them about this, and they didn't even know that existed, right? There's not a huge awareness. We're probably more aware on the insurance end than the doctors are. So low risk that ever happens under an N, right? You run into that. But I don't want to pretend like it can't happen.
Okay.
I don't want to scare you, but I'm going to say if it does happen, 15% cost, right?
Okay.
Well, the good news is, based on Aetna and Mutual of Omaha this last year, is that charge on average is less than $20 nationally.
Okay, that was my next question, is how much would that likely cost me if I ran into that?
I don't want to pretend like it can't, but when they look at averages for how few they have, it's under $20.
Okay,
right?
I can handle that, yeah.
Yeah, so I want your preparation if we do a transition like to this is what's the worst case, right? Worst case could be more than 20, but on average, it's about a $20 charge, about not even 0.66% of the time, but that's the risk of ever running into somebody that could even charge that.
Sure.
Okay?
Sure.
Now, that Part B excess charge, low risk, right? Probably not going to happen, but it's there. The G covers that for you 100%. The N does not. There are two other little areas that the N is a little different than the G.
Okay.
This is where Medicare is frustrating. Okay?
This is the part. Okay.
This is where, one of many. But this is where they use the word sometimes, and that is in the Medicare and You handbook.
Okay.
And it says that a Part N, even after you've paid that $240 deductible, if you remember under G, you pay $240, you're done paying copays.
Right.
Under the N, even after you've met that $240 deductible, it's possible that sometimes at a doctor's appointment, whether a specialist or primary, they could charge you $20.
So just a $20
copay.
Oh, okay.
Okay. Now, I want to talk about my clients that haven't it.
Okay.
I've got some that get charged $15. I've got most that have never seen a copay charge at the doctor. Here's where the sometimes comes in. It's up to that facility to decide when and how. So I can't look you in the eye and tell you if, when, or how it's going to happen. But what I can do is prepare to pay $20 every time. And when you don't, it's just a benefit.
Got it.
Okay?
Okay.
Does that make sense?
It does make sense.
The one other caveat that N does not cover that the G does is if you go to the emergency room and you do not go inpatient, rush to the emergency room, check you out, they send you home, you will get a $50 charge.
$50.
$50 flat charge.
Okay. Well, that I can handle. I was waiting to hear about a $300 copay or something like that. Just $50?
No, it's not bad. And that's why, honestly, this N is something we talked about last year, right? But when we compared, it was like, okay, there's these couple of risks. And if you remember, we were talking about a $10 to $15 difference a month.
Sure. Most
of my clients, when I lay that in front of them, they go, well, the convenience of that G just makes more sense. I think I'm going to stick with that.
Sure.
I don't disagree. Here's what happened.
Yeah.
Our G is going up exponentially quicker than our N. Our N is stabilizing. And this is where I said the industry is pushing us towards the N.
Okay.
One, N is a wonderful plan. So we're not taking a lot of risks. We just talked about those risks. But right now, generally speaking, I can get you in that N roughly $40 less a month.
Well, that's quite a bit.
Right?
Yeah.
So when I talk $40 a month, I want to talk bigger picture. Right? We're talking about $480 a year, almost $500
Do a lot.
a year savings, right? So that is why I think N is something we need to discuss today.
Okay.
Questions?
How many of your clients are making a transition? How many other people in my situation are moving from the G to the N?
Well, so literally we're coming into this. This is pretty new to us. But what I can tell you is the conversations be had more and more. Here's where I need you to give yourself a pat on the back and a lot of pride. I've got plenty of folks. I can't offer this because they're not healthy enough.
Okay.
I know they will not pass. So, props to you for taking such good care of yourself because I don't get to offer this to everybody.
Okay.
You are in a category of folks 65 and older. A lot of my 65 and olders, they just have chronic issues. This is never going to be an option, right? We're going to have to stay in a guarantee issue window, right? Just because issues. So Not a ton, but what I can tell you is anybody that I don't know the health history or I'm not up to date on, which I'm pretty good about that,
Sure.
I'm having this conversation with. And what I can tell you is a year ago, it was probably 90% roughly G to N. I expect this year it's probably going to be closer to a 60-40 N to G.
Sure.
And I expect by next year, we're going to be looking at 90 to 10 the other way. Now, that is a lot of assumptions,
Sure.
but that is where I see the market taking us. So what I'm telling people is for longevity, stability, this N can be a bigger thing. There's one other caveat.
Okay.
This is something that most people won't recognize. A G falls under what's called a guarantee issue category for Medicare recipients that A and B are in effect. They're leaving a work plan and they no matter what their health is, they're guaranteed into a G when they leave.
Got it.
The N is not in that category. And you're probably going, well, what the heck does that have to do with me?
I am, yeah.
Stability.
Okay.
So that N will not take on as many high-risk clients. So when we talk about the pool of people taking an N, it's going to be a healthier clientele because it doesn't take on the risk the G does of the high-risk clientels coming in on a guarantee.
Okay.
Does that make sense?
It does. So if I am on the N, I don't like the N, maybe I don't like the carrier that I'm on, can I go back to the G that I was on?
If we're healthy enough.
If we're healthy.
If we're healthy enough. And what you've got to understand, though, going back to the G we were in, here's the risk, is based on Missouri, it's going to be based on age. So we probably will not go back to the premium we had. There's a good chance we're going to take a higher premium risk, right? So that's once again why I want this to be in your hands.
Sure.
The good news is you stay healthy, we're going to be able to talk about the switch to N anytime we want. We don't have to wait a year and do this during guarantee. If we're going G to N, 4 months from now, if you go home and really think about this and go, man, I just think that N, or we watch the market really change and you go, man, this is something like I got to call Josh and then go get that in. We can do that at any time we like.
Okay. I think I'm comfortable with that. I think maybe let's look at some G options, but I, maybe want to talk to my husband or talk to some of my friends if they've tried the plan and if they've heard about that. I think that might be a route I'd like to look at later.
I love it. If you remember, my big thing is I never want to rush. That's one of the reasons I always have you in 30 days prior to the effective date during that window, because then that leaves us at least another month to resolve this if you need to make a decision, right? So we are in a good place.
Okay. Well, you know what? I think I'm still playing pickleball. I'm still doing my thing. Let's just go ahead and do the N today. Just kind of what you're talking about. I think it does make a lot of sense that, and I feel like I'll be able to maintain my health for that. So I do think I'd like to at least look at the price differences between the G and the N.
Great. Well, we'll pull that up. We'll compare. And then if we find a good product, because this is underwritten, it doesn't happen instantly. I've got a couple companies that I can, within 10 minutes, sometimes have an underwrite. Depends on the company.
Okay.
But we can always say no.
Okay.
If they accept you and you decide you want to stay with G, we can say no. But the reality is, it takes us 30 minutes to do an application. So we'll knock that out. We'll get that in. For most of these, it's going to be a week or two. So that gives us plenty of time to make a decision. They accept you. We won't have canceled out your other plan, right? So we're in a good place and we can make a final decision after that.
I think that's a great idea. I'd like to do that if that works for you. That way I don't have to worry about not getting into the plan in or what the case may be with my health. I should, but I think I really like that. Let's do that.
Sounds good.